Good morning, students. In this video, you are going to learn about care of patient with alcohol intoxication and withdrawal symptoms. The objectives are students will be able to explain alcohol intoxication and its presentation, enumerate the management of alcohol withdrawal symptoms, and will be able to discuss the nursing care of patient during withdrawal symptoms. Alcohol remains one of the world's most widespread recreational drug. Alcohol intoxication occurs when a person drinks excess of alcohol in one period. A low level of alcohol intoxication causes mild symptoms, while severe or alcohol poisoning can be life-threatening. It requires immediate medical attention. Alcohol intoxication is described as a mental and behavioral disorder by the International Classification of Diseases. After the acute intoxication has subsided, person may experience withdrawal symptoms. The signs of intoxication. When a person has taken excess amount of alcohol, the blood alcohol levels can be obtained to confirm the diagnosis, and when the blood alcohol concentration is 50 milligrams per dl, loss of emotional restraint and vivaciousness, that is, the person is very lively, feeling of warmth, flushing of skin, and minor impairment of judgment could occur. And when the blood alcohol concentration is 100 milligrams per dl, slight slurring of speech and loss of control of fine motor movements such as writing, confusion when faced with tasks requiring thinking, and emotionally unstable, inappropriate laughter. And when the blood alcohol concentration is 200 milligrams per deciliter, there's very slurred speech, double vision, patient is lethargic but able to be aroused by voice, and memory loss. And when the blood alcohol concentration is 300 milligram per deciliter, patient is stuporous and snoring. And when the blood alcohol concentration is 400 milligram per deciliter, patient is comatose, low blood pressure, irregular breathing. And when the blood alcohol concentration becomes 500 milligrams per deciliter, death is possible. It is mandatory to examine the patient, including the history related to having taken alcohol. Usually, the patient is a known alcoholic. He binge, overnight be drinking, usually don't eat, collapse in the early morning. That's because of drop in the blood glucose. On examination, the CVS shows heart regular rhythm with tachycardia, and lungs clear to auscultation bilaterally. Abdomen is usually soft, non-tender, non-distended, no guarding or rebound is seen, and the bowel sound is heard. In mental status examination, it reveals sleepy but arousable, oriented to time, place, and person, and impaired attention and memory is seen, impaired judgment, slurred speech, incoordination, unsteady gait, inappropriate sexual or aggressive behavior. Let's see the pathophysiology. Once alcohol is consumed, it is absorbed through the proximal gastrointestinal tract, the stomach, and the duodenum. The peak level reaches within 20 to 90 minutes of consumption. Primarily metabolized in the liver by alcohol dehydrogenase 2 acetaldehyde. Acetaldehyde is a toxic substance and is usually broken down to acetate and acetyl-CoA. When it starts increasing, gives to ketone body production, and that causes ketoacidosis. It depresses the central nervous system. Gamma-aminobutyric acid is the primary central nervous system inhibitory neurotransmitter. GABA binds to receptors, allowing chloride to enter the cell, which increases cellular excitability. Alcohol binds strongly to GABA receptors, results in sedation, cognitive dysfunction, and decreased coordination. Further breaks down to water and carbon dioxide. The management. First, the immediate management. Patient is received and he is fully intoxicated. Blood sugar must be checked. If patient is found to be in hypoglycemic state, IV fluids have to be started, but very important is thiamine 100 mg IV or IM to be administered to prevent precipitating Wernicke's encephalopathy. Wernicke's encephalopathy presents with confusion, loss of muscle coordination, that's ataxia, that can be seen with leg tremors, vision changes, nystagmus could be seen, double vision, eyelid drooping. Evaluate patient for any trauma. If there is, patient has to be taken care of. Assess for conditions that mimic alcohol intoxication, such as stroke, elevated ammonia, metabolic derangement. General management, observation is very important. Vital signs has to be taken and recorded until the patient is clinically sober. Be mindful for withdrawal symptoms. The alcohol withdrawal symptoms. This usually begins within 12 hours after abrupt discontinuation or attempt to reduce consumption. The severity of the withdrawal symptoms ranges from mild to moderate and severe. The mild withdrawal symptoms: heart rate increased, temperature increased, blood pressure systolic normal, diastolic usually elevated, mild diaphoresis, and central nervous system, patient is oriented, no confusion, mild anxiety, restlessness, and tremors are seen. In moderate withdrawal symptoms, heart rate ranges from 100 to 120 per minute, temperature increased, blood pressure systolic increased, diaphoresis obvious, central nervous system intermittent confusion, transient visual and auditory hallucinations, illusions, insomnia, nightmare, and painful anxiety. And in severe symptoms, heart rate more than 120 per minute, blood pressure elevated, diaphoresis is marked, central nervous system marked disorientation is seen, patient is confused, disturbing visual and auditory hallucinations present, illusions and delusions also seen. Other symptoms include withdrawal seizure. There is generalized tonic-clonic seizures which occurs between 12 to 48 hours after the last drink, usually a heavy drink. Also sometimes status epilepticus occur. If untreated, can lead to delirium tremens. Delirium tremens occurs between 2 to 4 days of complete abstinence from heavy alcohol drinking, and the recovery usually occurs between 3 to 7 days. It is characterized by vivid hallucinations which are usually visual. Tactile hallucinations can also occur. Patient is disoriented and there are autonomic disturbances seen such as sweating, fever, tachycardia, raised blood pressure, pupillary dilatation. Apart from that, insomnia also could occur and dehydration with electrolyte imbalance. Agitation. Severe psychomotor agitation is seen. Patient is shouting with fear, and the blood test reveal leukocytosis and impaired liver function. Death is usually due to cardiovascular collapse, infection, or self-inflicted injury. The other symptom could be Wernicke's syndrome. Wernicke's syndrome It is caused by thiamine deficiency and it is characterized by prominent cerebellar ataxia, palsy of the sixth cranial nerve, peripheral neuropathy, and mental confusion. Korsakoff psychosis is also known as alcohol amnestic disorder. The prominent symptom is gross memory disturbance. Other symptoms include disorientation, confusion, confabulation. Confabulation is the unconscious filling of memory gaps by imagined or untrue experiences, and poor attention span and distractibility and impairment of insight. We have discussed about the withdrawal symptoms, and now let's discuss about how to manage the patient during withdrawal symptoms. The first, the medical management. The patient, usually a chronic alcoholic, having kept abstinence, now is in anxiety. So the treatment with benzodiazepines, lorazepam, diazepam, usually diazepam 40 to 80 milligrams per day is administered, and along with Librium, chlordiazepam 80 to 200 milligram per day is administered. It is the drug of choice and it takes care of the anxiety of the patient. And when the patient is having hallucinations, patient is given antipsychotic agents, namely haloperidol. And thiamine is administered usually 100 milligrams IM or IV twice daily for 3 to 5 days, after which it can be continued orally for 6 months. Giving thiamine reduces ataxia and other symptoms such as vernix encephalopathy. Apart from that, to control seizures, phenytoin is administered, and IV fluids, usually dextrose, is given to prevent hypoglycemia. And magnesium sulfate is administered prophylactically, which enhances body's response to thiamine and reduces seizures. Usually 1 gram IM QID for 2 days is given. Nursing management. One has to obtain information regarding the drug and the amount consumed from the patient if possible or from the bystanders. Approach the patient in a calm, non-judgmental voice in order to reassure him, and explain the patient or the bystanders about the treatment plan and the management. Monitor vital signs. Blood pressure has to be monitored strictly if the patient is on phenytoin because it can lower blood pressure. And also you have to monitor the level of consciousness and orientation. And provide safety in order to ensure seizure precautions, which include keeping oxygen and suction available at bedside. Administer medication as per the order. Usually anticonvulsant medications are administered. Provide physical needs such as food, fluid, and eliminational need. Collect blood and urine samples for drug screening. Maintain intake and output chart and increase fluids as required. There are some don'ts which you will have to keep in mind and follow. Do not attempt to constrain the patient. Do not give any medications without prescription. Do not give food, coffee, tea during the initial period of withdrawal symptoms, and do not induce vomiting, and do not let the patient operate a car or motorcycle. And on recovery, approach the patient in a non-judgmental way. Assist the patient in assertive techniques and set limit for manipulative behavior and encourage the patient to come for follow-up if necessary. Take-home message. History and physical examination are key to confirming intoxication. Check blood sugar to consider alternative causes of altered mental status and ensure there is no traumatic injury. Management of intoxicated patient means observation until the patient is not considered a harm to themselves or others. Beware of withdrawal symptoms including hallucinations, seizures, and delirium tremens, and treat with benzodiazepines and other anti-anxiety agents. Remember and follow the do's and don'ts while taking care of patients with alcohol intoxication and withdrawal symptoms.